see her. Hi, my name is Dr. Nicole Matthews. I am a clinician at the Judge Rotenberg Center. I've been there for 4 years. I also teach at Northeastern, Craig College, and University of Massachusetts. I'm on the board of directors for the Comprehensive Mental Health Systems, and I'm also a consultant for the Valley Psychiatric Services in Springfield, Massachusetts. So my only perspective is not just from the Judge Rotenberg Center. I wrote something, but now I feel the need to address a lot of the things that have been said today that either aren't accurate or somebody uninformed talked about. First, I would like to ask if any of y'all have been to JRC.
I'm sorry.
Have you been to JRC?
I have not.
I would invite you to come out.
I actually requested to be out there at the time and they said I couldn't come out, so I was really kind of put up.
Yeah, I don't know why somebody would have said that. Come on, I'm inviting you. You can come on.
I need to go, that is something. I actually asked, I specifically asked with a representative, I asked to go out there and they said, no, you can't come out. So I was really put off at that point.
Yeah, I don't know why that would have been
But
said.
that's
It's an
what
open door
happened,
policy,
I was really concerned about
yeah.
that myself.
I don't know who you talk to, but come on. You can be my buddy and we'll go.
We're actually going to put together a series of meetings with the committee and experts who come and testify as experts.
Okay.
Because there's so much that many of us who are new to the committee do not know.
Right.
And maybe we could include a tour for the committee if committee members are interested in going to the Judge Rotenberg.
I'm interested in going.
So I think you can plan that that's something we will do.
That'd be great. The first comment I'd like to make is that the average is 12 months. It's not the hard and fast rule. There's not a hard and fast rule. Somebody that's severely damaging themselves, we're not going to wait a year. The second point is there are 3 studies that the Judge Rotenberg Center or affiliates have been working on. One has been published. It's on the side effects of skin shock. 2 others are in press. One is a series of case studies, and the other one is on the effect of the GD on aggressive behaviors. So there is research coming out of JRC. Somebody made that comment earlier, and I'd just like to address that. Other research does show that only 50 to 60% of students, patients, clients that have behavior problems can be effectively treated with positive only, even if a communication component is included. So that leaves us 40% of people that need some help, and oftentimes they end up at JRC. The people that have said, I worked really intensely with somebody, they had the worst behaviors I've ever said, but they came around, they're not at JRC for a reason. They came around. We don't end up with those kids or those adults. We end up with the students that we cannot help or that others have not been able to help at that point. And everybody keeps forgetting that we're positive. We have the most dense, rich, positive reward system of any place I've ever been to, looked at, or heard of. Our positive therapy is intense. And when it fails, then it's failed. Positive behavior supports have failed whenever JRC's positive program is not able to be effective. You've asked, I think it was you or the gentleman sitting beside you, if advances have been made and if they're brought to our attention. The clinicians often attend conferences. There's case conferences where psychiatrists, psychologists, outside people come together around a table. We talk about the student. They offer up ideas. We talk about ideas, and new interventions can be implemented based off of that. We're not archaic. We read the journals. We're BCBAs, et cetera, and we have to keep up with CEUs and the current therapies. So we do so as it comes out. The GD, it hurts. It's supposed to. I've had it over 50 times. Doing demonstrations or at conferences, and you show people and they want to see, and they want to see if it leaves a burn. It does not. I'm not a big girl. I'm kind of wimpy. So for me to take it 50 times and not scream and flinch and fall to the floor should say something. Often it's demonstrated in a public arena like this, and people want to make a spectacle, and then they flail and scream, and it's quite ridiculous. But let me show you, or somebody else show you, that it's not what other people have made it out to be. I would put it on me. I'll show you. Yes. I don't know. I think we do that still, I'm assuming. Other things that people have mentioned, Sullivan Associates, we do have students that went there. We also get calls from their guardians asking us to take them back because the program's been ineffective for their students. So a student may leave, but that doesn't mean that they're being, a quality of life hasn't declined while they've been wherever they were sent to. The 2000, I don't know what Senator Sybeck was talking about exactly when he said in 2001 100% of our students came in on GED. I've worked there. That's just ludicrous. I don't even know where that came from. Maybe he heard wrong, or maybe he read something incorrectly. But that is absolutely untrue. And as in regard to the burns, DPPC came out and has done extensive investigations of supposed burns that we've had at the center. One of our nurses will talk to this later. They investigated thoroughly and completely over months, and no burns were found to be, no burns were found. And we have the report. If you would like that submitted, you can also read the report DPPC submitted in regard to that. GD and GD4 are different. Most of our students, somebody discussed that you needed to up the ante whenever you start aversives. Andrew has been on the regular GD for over 10 years. You don't have to up the ante if it's effective. There are students who are on the GD4, however, it's because the GD was not effective for them, just to make that clear.
Thank you.